So I'm going to review the patient's chart before entering the room and just check for doctor's orders. I'll knock. Hello, I'm Abby from Respiratory Therapy. I'm here just to do some trach cares. Can I get a name and date of birth? Thank you. And I can do my pre-assessment, listen to lung sounds, breath sounds, check oxygen levels, check the pulse. We're going to remain sterile throughout this procedure, so I will wash my hands and apply the proper gloves. I can set up my basin, which is going to be hydrogen peroxide and sterile saline water. Once I have that all set up, I can remove the oxygen. If the patient's on a trach mask, I can remove that. If there was any suctioning that needed to be done, I can get the suctioning done. And then following that, I would remove the old dressing. The inner cannula, if it's disposable, I'm able to toss that and just enter or reapply the new one. If it's not disposable, I would take my hydrogen peroxide with a pipe cleaner and just get it cleaned and then reapply it. Then I'm also able to take a Q-tip with the hydrogen peroxide and kind of clean up the stoma site before applying the new pre-cut gauze, which would go around it. I would remove any old ties, place in new ties if needed, just making sure everything's all cleaned up. And then once I'm finished, I can make sure to reapply the trach mask that the patient is on. I'll just also want to verify that the patient is on the correct flow, they are getting adequate oxygen. I will clean up my supplies, dispose of them in the proper place, ask if they need anything, if they're feeling any better, if they have any concerns, and then once I'm finished, I can go chart, and yep.